I don't often watch TV shows that have to do with a character with autism, just because I get kind of distracted, like trying to analyze if the character was doing a good job displaying autism or if it was too Hollywood. But recently a bunch of people asked me to actually do exactly that. Watch an episode of, let's say, The Good Doctor, and kind of talk about what I think is really autism and what I think is more Hollywood. So right off the bat, the first thing is, you know, you see the main actor brushing his hair really neat and tidy, which makes sense because a lot of people with autism have some kind of obsessive types of symptoms as well. But then he comes back and he kind of like moves his hair around and gets more of a disheveled look, which honestly I can't see someone on the spectrum doing that because, as I said, like most of the time people with autism actually like to be very tidy and orderly. I see he's having a memory now, I guess, of when he was younger and being bullied, which sadly happens a lot to people on the spectrum. Even though like these days we know so much about autism, there's still a bunch of bullying going on, which is very heartbreaking. And I think the other child who comes to his rescue is his brother. Okay, they've done a really good job here, kind of showing us all the sights and noises and everything that happen in an airport. I can actually see that would be very, very disturbing for someone with autism. A lot of times we forget that people with autism have very, very sensitive sensory input. And so places like airports are really disturbing because they're loud, there's so much going on, there's a lot of people around, noises, all kinds of stuff. Yeah, that could be very traumatic.
His jugular vein's been cut.
Does anyone have a clean cloth? Please, someone!
I have a fresh change of clothes in my bag.
That's great.
You're killing him.
I'm saving his life. He was bleeding out.
You have it in the wrong place.
I think I remember enough of Anatomy 101 to know what the jugular vein is.
You would be in the right place if he were an adult. He's not an adult. He is a boy, which means you're also putting pressure on his trachea, which means he's not currently breathing. You have to put the pressure higher up. There.
I love that. Yeah, I love it when our guys, people on the spectrum, like show how smart they are.
Shaun Murphy. I'm the surgical resident at San Jose St. Bonaventure Hospital.
I love that. That was a cool scene there because like it is kind of very realistic. But I love that he introduces himself with the full title, which I could see somebody doing that because although to us it might be a little socially awkward, it is very much what someone on the spectrum might do.
Autism, a mental condition characterized by difficulty in communicating and using language and abstract concepts. That's the definition. Does it sound like I'm describing a surgeon?
He's not Rain Man. He's high functioning, he's capable of living on his own, capable of managing his own affairs.
High functioning. Is that our new hiring standard?
If it were, you wouldn't be here. I'm sorry. Is this really necessary? Really? A special meeting?
I mean, there is a huge kind of difference in this range on the spectrum. There are people who are very capable and still get the diagnosis.
Stop acting like you're stunned that you're standing there. You tried to slip one past us.
I vetted him like I would any other candidate.
Hospitals are usually very political.
Wouldn't reasonably have any doubts about hiring a surgeon who's been diagnosed with autism. So justify your decision.
I met Shaun Murphy when
I mean, this is a few years old now, this episode, but I love that it actually like highlights how much bias there is about autism or any kind of disability for that matter. And I think things have gotten a lot better now, but I could definitely see a hospital board not giving an opportunity to someone who has a diagnosis. I could see that happening.
he was 14 years old. I was living in Wyoming at the time. He was, and he still is, an extraordinary young man. Yes, he has autism, but he also has savant syndrome. Genius level skills in several...
I mean, there's no real label called savant syndrome. That's kind of very Hollywood to do that, but truth is there are people on the spectrum who have savant skills, which means they do certain things that the rest of us cannot do. Like, you know, they can see things in a different way, they can they have photographic memories, they have ability to count things in the environment just by looking at them for a moment. So there's definitely, that does exist. It's very rare. People think that every person with autism has that. No, it's quite rare, but I have seen some incredibly unique people.
He has almost perfect recall. He has spatial intelligence, and he sees things and analyzes things in ways that are just remarkable, in ways that we can't...
That I love. I love that. That's so true of autism.
Undeniable assets for any doctor, particularly a surgeon.
You've known him since he was 14.
You care about him. He's like a son to you.
Dr. Andrews, your wife is going to be very upset with you. If you're trying to turn this into a nepotism case, we're going to have to fire her idiot nephew from bookkeeping.
So like now he's looking at the veins in each of this little boy's arms. And I'm guessing he's gonna figure something out that no one else has thought about.
The veins in the boy's left arm are popping.
Is that bad?
I don't see.
Intrathoracic.
That means it's kind of side by side, one side and the other side not together.
Moving paradoxically. The left lung is in distress. Yes. Who here has a sharp knife?
In an airport? I don't think so.
Nobody? You should start artificial respiration. He's going to stop breathing very soon.
I mean, they're showing him to be very kind of like robotic and not have emotion. And I'm not sure I agree with that. I feel like he might be like fast and finding solutions, but I don't know that he wouldn't have emotion around it. I think he would probably have some emotion. Okay, so I guess he's looking for a knife.
Where do you keep the knives people forget they're traveling with?
A knife. Sure. Anything else?
I do also need a narrow 6-foot tube and high-proof alcohol and gloves and baggage handling tape, but I'm going to get the alcohol from the duty-free store and the tube from the back of the soda machine.
Well, I wish you all the luck with that, but I'm not going to give you a knife.
No, I need a knife. It's very, there's a medical emergency. There's a medical emergency.
That was kind of cool because like it felt like he was almost like he had memorized that he needs to label what's going on, like title the situation, like it's a medical emergency. And that I could, like, a lot of people do that. So one of my recovered kids, or now adult, told me that a lot of times he has to just, it's sort of, when he's speaking, he has to apply rules to that he learned when he was younger. So like, you know, always introduce a situation by giving it a title. And that's exactly what he just did there. So that's pretty good writing that they've taught him to do that. Let's see what he does. I don't know how he's gonna get a knife in the airport.
That one right near the top.
It's very sharp. Would you
Okay,
get it for me?
so these are like knives that they've confiscated from people going through security. I don't know how many people. Okay, and now he grabbed a knife and he's running away. So a couple of things here. One is like, this is kind of Hollywood because people on the spectrum are more rule governed than neurotypical people. Like they do not want to break rules. So I can't see him stealing something and then running off with it, because that just seems, that's not something they would do. But anyway, the positive side is when he's running, you can see that he runs kind of in a stiff way. And I've had a lot of like children and teenagers where I've actually had to teach them to lift their arms when they run, because when we run, normally our arms go behind on our sides like this, but sometimes an individual with autism might not even think about that and they'll run kind of in a stiff way, and he does a pretty good job of showing that. Well, thank God she showed up and explained to them so they wouldn't harm him. It always makes me very nervous when I see like police or authorities manhandling individuals on the spectrum, because sometimes they have a hard time, the person has a hard time expressing themselves or saying what they're actually doing, and this kind of thing happens all too often, which is a little bit scary.
Excuse me, please.
Okay, so this is very Hollywood. Like, we have a very short window here where this child is bleeding internally, and he now went and got 2 bottles of, looks like Jack Daniels, and a knife, and a tube from behind a vending machine, which I don't know how easy it is to pull a tube out of a vending machine in an airport. But anyway, the timing on that seems a little bit Hollywood to me. And now he's cutting the tube and producing some device that is going to help with this child's breathing.
Incision should take place 2 ribs down.
He kind of repeated that, which makes sense. It's like as if he's reading from a book. And he's sticking the tube in. Okay.
Okay, well, why the bottom?
The air will continue to leak and accumulate until the damage can be properly repaired. The tube allows the air to get out, the water in the bottle stops the air from coming back in.
I'll make one right now.
All right.
He's breathing. You saved his life. You saved his life.
That's pretty cool. I love that. I love it. Okay, and now the dad and mom are both hugging him at the same time. Like something they could have done here, because a lot of folks with autism don't really like to be confined. And especially if 2 people are hugging you at the same time, it might feel a little weird. So he could have like shown that he's uncomfortable there, but he seemed to be just fine. Okay, so he's in the ambulance now. Oh, he's remembering again, holding a bunny. And I like that they have him like slightly body rocking. That's a very common thing, especially like if he's anxious, which it looks like he's very anxious. It looks like he has an abusive dad, yeah. Oh, and that's the brother trying to defend him. Oh, can't watch abuse scenes. Oh, and he took the rabbit and threw it. That's, ugh. Horrible.
It changed. The boy's ECG changed.
It's the same. 86 BPM.
No, it used to be higher.
No, it used to be 86. It's still 86.
It used to come up to here. Lower amplitude means lower voltage. Lower amplitude means lower voltage.
What's going on? What does it mean?
It means he's trying to read 20-year-old equipment while traveling in a vehicle going 40 miles an hour.
And he probably can.
How did you get him to sign?
I've simply told him he's either consenting or going home.
See,
Then I give him
I hate it when people don't listen just because they have like preconceptions of who this person is, or they think they know better.
Hold on.
8-year-old healthy boy. Status post-encounter with a shattered glass sign. Numerous lacerations.
Echo.
Get him set up in trauma 3 with an EKG, full blood work, and a pan scan.
We need an echocardiogram.
Who is this guy?
He helped with first aid at the airport.
I'm the doctor. He needs an echocardiogram. Where are you taking him?
Surgery. All cardiac vital signs.
You know, one thing that I really like about the way this actor is portraying the character is that you can see, if you pay attention, that he's not really giving anyone direct eye contact. He's kind of like looking in space, and that is kind of typical. A lot of people with autism have a hard time focusing on someone else's eyes. So, you know, I think he's done a good job with like the kind of the movements and the eye contact and all of that.
Within normal range. Do you have any ID?
No, his heart. It's his heart.
His heart is fine. I'm still here.
Adam needs an echocardiogram.
No, behave yourself.
Okay, so they're not listening to him. And now he's like trying to get them to listen. So they throw him out of the hospital. Great. That helps.
What's that?
A one-way valve. EMT reports the boy suffered a pneumothorax.
That is cool.
Do you think we should do an echocardiogram?
Based on the presenting symptoms, which give no indication that an echocardiogram is necessary, I'm going to answer no. Am I missing something?
No, sir.
Knife?
Poor guy, he's like trying to get into the hospital and the security is just like making sure he can't get in. I mean, he's very, very focused on trying to help this one child. But I think like someone with his level of medical skill should probably be able to like call and say, you know, I'm stuck outside. He should call the main guy at the hospital and say, I'm trying to do something. I'm trying to get in. They won't let me in. Let's see. He looked up and saw something.
Treat rabbits, especially.
This was the closest doctor place, and it was an emergency.
Oh, he's having a memory again of when they were children.
Is dead.
Oh.
I'm sorry, guys.
Everything smells different when it rains. What do we do now?
Well, you should bury him, I guess.
Oh, that's his rabbit.
Give him a nice funeral.
Has he gone to heaven?
Yeah, sure he has.
No, I don't want him to go to heaven. I want him to be here.
Oh.
This won't happen again.
It can't happen again. He's dead.
I know that. I mean, nothing like this is ever going to happen to us ever again. Because we're not going home. We're never going home again. We have each other, and that's all we need.
A surgeon needs to communicate.
Oh,
not
so
just
that's
information.
the guy that invited him to the hospital.
Simply.
President of the hospital.
Can Dr. Murphy do that? He can't even reliably show up for a job interview. Are you going to sit here and tell us that there were no other equally qualified young surgeons? Surgeons without this one's issues.
No. Which is why, exactly why we should hire Shaun. We should hire him because he is qualified and because he is different. How long ago was it that we wouldn't hire black doctors in this hospital? How long ago was it that we wouldn't hire female doctors at this hospital?
So you're comparing being African American or a woman with being autistic. Please, go on.
Okay. The rationalization is exactly the same.
Yeah, that's
Whereas,
awesome that they're addressing this issue.
No. Oh, how are the patients going to react? Aren't we judged by how we treat people?
Yeah.
I don't mean as doctors, I mean as people. Especially those who don't have the same advantages that we have. We hire Shaun and we give hope to those people with limitations, that those limitations are not what they think they are, that they do have a shot.
Yes, I love that. Love the speech. So good.
We hire Shaun and we make this hospital better for it. We hire Shaun and we are better people for it.
We'd be better people, spending a lot more on malpractice insurance.
How old is this kid again? 8.
That was a great speech. You know, I love it when we give people chances and then they shine, which I'm sure he's gonna do.
What was his heart rate 5 minutes ago?
86.
You sure?
That's it. He's been a rock. He's barely changed.
Something's changed. Something's different. You asked earlier about an echo. You had no medical reason, but you asked anyway. Why?
There was this weird guy, the one that did the one-way valve. He kept insisting that the boy needed an echocardiogram.
He didn't say why.
He was really weird. His blood pressure's dropping. That makes no sense. He's not bleeding anymore. Everything's under control.
Do an echo.
So, boys, wide open. It's gonna take a while.
Good. That'll give me time to figure out why the hell we're doing an echo. Dr. Brown, you're with me. We're gonna go find your weird guy. Keep him stable.
Awesome. Finally. Oh my god. The poor guy's outside wet in the rain.
Okay. Okay.
I understand you think he needs an echocardiogram. We just don't know why.
Well, I noticed that there was a slight reduction in the intensity of the electrocardiogram.
Electrical flow. I noticed that too. The heart rate was the same, but the amplitude dropped.
Pericardial effusion.
Reduced cardiac output.
It's stress on the organs.
Causing them to shut down.
Yes.
Finally, someone listens.
Yeah, we're coming right back up.
Awesome.
They did the echo. It's normal. No pericardial effusion.
No, it has to be.
Oh.
There is no other explanation.
The echo is normal, which means we just wasted our time.
Okay, so he's like thinking and trying to figure out in his head what is going on here.
Okay, hey, come with me.
Good, thank God. Get him inside, he'll figure it out.
Show them.
Again? 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 Damn.
Looks normal to me.
It's not normal. There's a concave deformity in the right atrium.
Yes.
No, there's not.
Yes, there is. It's very subtle.
Even if you are right, that's not where a pericardial effusion manifests.
Not usually. But it could. This kid was sprayed with glass shards, cut his jugular. What if a piece of glass entered his bloodstream? It could have traveled down the jugular vein, into the brachiocephalic vein, and onto the superior vena cava. If it punctured the SVC, the blood could be looking behind the heart, restricting the heart's ability to expand and fill during diastole, reducing the heart's efficiency.
What if that?
I feel like that whole explanation was for us.
Dr. Chen,
Pair of 14 gauge on syringe.
Okay, they're gonna get it now.
All in favor of ratifying Dr. Glassman's decision in hiring Dr. Shaun Murphy?
Come on, guys. Come on, let's get a majority. Oh no.
All against?
Oh my god. They have like 2 people say yes.
Excuse me. Is this a medical emergency?
No medical emergency.
You weren't supposed
Yes, I know, but you need to go online. What site? Pretty much any of them. Twitter, YouTube, any local news site.
Oh, now they're showing him at the airport, so now he's a hero. Thank God that they see that and give him a chance to show how smart he is.
100,000 views. Apparently he's one of our doctors.
Dr. Shaun Murphy saved this boy.
Yep.
The boy is an OR too. Dr. Melendez isn't sure if he's going to make it.
He'll make it.
Your fiancé sure can't handle a knife.
Why did you warn me about respecting Dr. Andrews? Is that your guy?
Everybody.
Okay, so they're watching the surgery now. I hope it works. Oh, now he has another memory, okay. Their kids getting on a school bus, or like an abandoned school bus.
Why not?
Oh.
Because we're poor, dude. We live in a bus.
Oh.
Do you think Mom is looking for us?
No.
Oh my god, that's so sad.
She loves us. But she knows it's better this way.
Mm.
I got you a present.
It's not my birthday.
I got you a present anyway.
Dude, that's very real, like that he would say it's not my birthday, because that's kind of a rule that he's learned. You get presents on your birthday and not on other days. What an awesome brother. Oh, it's like a plastic scalpel. Like his first medical kit. Oh, that's why he does that to his hair. That's why he mixes up his hair, because his brother used to do that to him. Okay, that makes sense. Now I get it. And that's why he carries around that plastic scalpel. Oh, that's so sweet. I love that storyline. That's well done. Come on, guys.
Dr. Brown?
A piece of glass.
You were right.
They found a piece of glass. Oh, thank God. That was a good scene. Oh, I love that. That's awesome. Okay, I'm gonna really like this show. I'm gonna have to watch a lot more of it.